Welcome everyone we are so happy that you could join us today for our webinar, Navigating Complexity-Aware Monitoring, Real-World Application of Key Resources and Approaches. My name is Devin Degnan, and I am a program coordinator on the USAID-funded Momentum Knowledge Accelerator project at Population Reference Bureau. Today's webinar is co-hosted by Momentum Knowledge Accelerator, or MKA, and the Country Health Information Systems and Data Use Program, or CHISU. Momentum Knowledge Accelerator is part of the Momentum flagship suite of integrated projects aimed at accelerating improvements in maternal, newborn, and child health, nutrition, and voluntary family planning and reproductive health. MKA serves as the connector across the suite of projects by building systems and creating tools for sharing data and information to advance learning and better achieve Momentum's objectives. CHISU is USAID's flagship project out of the Office of Health Systems that supports many different information systems and data across a wide variety of health areas, including global health security, HIV, malaria, COVID-19, nutrition, and maternal and child health. CHISU envisions country health systems in which stakeholders at every level, including health workers, can access high-quality data generated from multiple interoperated data sources and use those data to guide policy and improve resource allocation, service delivery, and system performance. CHISU is currently supporting around 22 countries on their journey to digital transformation. Today we're hoping to introduce you all to the concept of complexity-aware monitoring, or CAM. We'll discuss the added value of using CAM approaches and the intersection between CAM, traditional monitoring and evaluation approaches, and adaptive learning. We will explore Momentum's complexity-aware monitoring guide, which is currently the most downloaded resource on the Momentum website. The CAM guide was developed to support Momentum partners that are looking to enhance their own monitoring, evaluation, and adaptive learning, but it can be broadly applied to other organizations and projects who are looking to do the same. Today, we'll also provide you with a short overview of a number of CAM approaches that can be found in the CAM guide. We'll discuss their applicability and how to choose the right method for your purpose. Before we begin today, I want to go over a few housekeeping announcements. If you haven't done so already, please introduce yourself in the chat. You can tell us your name, organization, and where you're joining us from. Our webinar today, as you may have noticed, is being recorded. We'll be posting the recording to our Momentum YouTube channel, and we'll share it along with our presentations with all participants following the webinar. At the end of our two presentations today, we'll hold a question and answer session. Throughout the webinar, you can feel free to put your questions in the Q&A function in Zoom, which should be at the bar at the bottom of your screen. Please do not add questions to the chat. Please try to keep them in the Q&A function. You'll be able to see everyone's questions as they come in, and you can even upvote or like other people's questions that you also want answered. We'll do our best to address all of the questions by the end of the webinar. And finally, please keep your microphone on mute and your camera turned off to reduce background noise and preserve bandwidth during the presentations. However, during the Q&A session, we'll welcome you to come off mute and turn your camera on to ask questions if you wish. To start off today, we're going to do a little interactive activity with a poll question. I am going to launch that poll question now. You should be seeing it pop up on your screens. Our question for today is, how familiar are you with complexity-aware monitoring approaches? I'll give you all a few seconds to get your answers in. We'll leave the poll open for just a few more seconds. Okay. Great. So now if we look at the results, it seems like our audience today is a bit of a mixed bag. So we have 18% of people saying I've never heard of the term. So today we'll definitely explore CAM and what that means. 37% has said they've heard of it, but never used it personally or in their own projects. Some have said they worked on a project that used this approach, but did not use it themselves. And 22% says that they have used one or more complexity-aware monitoring approaches. So thank you all for doing that little brief interactive activity. So if we go on to our next slide, I am now delighted to introduce our first speaker and my colleague on the Momentum Knowledge Accelerator project, Emily Stammer. Emily is a senior research monitoring and evaluation advisor with over 15 years of experience working in both academic and program-focused settings. Emily's experience lies largely in the area of monitoring and evaluation of reproductive, maternal, newborn, and child health programs using innovative mixed methods and adaptive approaches. She currently works for JSI, which is a core partner on MKA, where she champions complexity-aware monitoring approaches and adaptive learning, and works to build capacity in these areas across our suite of awards. So over to you, Emily.
Great. Thank you so much for that intro, Devin. Thank you, everybody, for joining us today. And I'm looking forward to talking with us more about complexity-aware monitoring. Before we dive right into the main course, I wanted to mention, I wanted to mention that the content that I'll present from this session is based on multiple resources that have been developed through Momentum. This session draws heavily from the Complexity-Aware Monitoring Guide that was developed in 2020, which includes an overview of a few different approaches and examples with suggestions about when and how they may be used. We also conducted a virtual CAM workshop series in 2021 that included 5 sessions that focused on different approaches and included presenters who talked about how they applied the different approaches in their work. And then other resources from Momentum, such as the Adaptive Learning Guide and the Adaptive Learning Toolkit, provide an introduction to adaptive learning, including key steps to integrating adaptive learning into your programming. We will share a QR code at the end that will take you to a website where all these useful resources are curated. So what is complexity? Let's take a brief moment to dig into the background here. Complexity-aware monitoring is a set of measurement approaches that are useful in, you guessed it, complex settings. So people always want to know, well, what counts as complex? Is what I'm doing complex? And here's one way to think of it and to define complexity. As the figure shows, complexity is really a continuum between simple and chaos. And it occurs when there is a lack of both strong certainty and agreement on what needs to be done. A situation can be complex as a result of the intervention, the context, or both. So the slide also shows 2 questions that you can ask yourself to help determine if the setting you're working in is complex. First, are you implementing a simple, straightforward intervention in a nice, stable, well-defined environment? And second, do you expect your work plans to be implemented as originally written, without delays or changes? If the answer to both of those is yes, please send me your contact information. I would like to work on what you are doing because that sounds amazing. Kidding aside, in the field of global public health, the answer to both of these questions is often no. It's not straightforward, and we don't have a nice, everything doesn't go as planned and in a nice linear fashion. So this is where complexity-aware monitoring approaches come in and can be helpful. So I'd like to talk a little bit about what complicated means for socially complicated settings. So socially complicated settings are those, in many projects that are being implemented, there are certainly social complications. So you have people, ideas, resources from one country or setting or context and they're trying to come together with people, resources, and ideas from another country, setting, or context. And then within a country, you have people, ideas, and resources from one group, say urban professionals or government officials or healthcare workers, and they're trying to create change with another group of people and their resources and ideas, such as farmers, mothers, nurses, doctors, or religious leaders. And it's a lot of different people coming in, engaging, and kind of mixing up. So one way to know if your situation is socially complicated is if you're holding stakeholder engagement meetings, you're probably doing that to try and overcome some of these inherent social complications on your project. You're working to get some common agreement and understanding of the problem or situation. Technically complicated, what does that mean? And I assume most people have seen this image before, and the idea that reality is not as neat as it is planned. You know, do you feel like this may describe your work? Do you have these good days and bad days, and days when your data or implementation goes in the right direction, straight from inputs to outcomes, and then days when you're all over the squiggly line, when the data doesn't make any sense at all? And yeah, this is what we mean by technically complicated. So in these settings, there's a lack of certainty or the right answer, in quotes, or a nice, clean, linear pathway. So here's a summary of some of the aspects of complex interventions and the complex systems that we've talked about so far and that you may work in. So in complex interventions, there's unclear causal pathways to outcomes. You have lots of changes happening in parallel at the same time. You've got feedback loops, there's a number of outcomes, and perhaps unexpected outcomes that emerge while you're implementing. And those interventions can be housed within these complex systems. And we work within complex systems with numerous diverse stakeholders, making consensus difficult, contextual factors that affect the work being conducted, new information continually being introduced, and an unpredictable environment and pace of change. And so in these settings, this is when we can use complexity-aware monitoring approaches. So what is complexity-aware monitoring? This is USAID's working definition of complexity-aware monitoring. And complexity-aware monitoring is appropriate for aspects of strategies or projects or activities where cause and effect relationships are poorly understood, thereby making it difficult to identify solutions and draft detailed implementation plans in advance. Expected results may also require refinement and revision as strategies and projects unfold. Projects or parts of projects that rely heavily on adaptive management to steer effectively in these dynamic contexts, and projects that seek to influence social change or innovate to discover solutions are good candidates for complexity-aware monitoring approaches. On the other hand, projects that deliver services or roll out, replicate, or scale up this, tried and true programming strategies aren't necessarily the best match for these monitoring approaches. Next slide. So complexity-aware monitoring has a few guiding principles. And the application of these three principles can be invaluable for monitoring the emergent and dynamic aspects of strategies, projects, or activities that you're implementing. And when you apply these principles to your own situation, you may discover new monitoring solutions. So most monitoring solutions, there's attending to performance monitoring's three blind spots. Most monitoring plans do not address, one, a broader range of outcomes associated with intervention or systems, including intended, unintended, and positive and negative outcomes. Synchronizing monitoring with the pace of change. And that is as the pace of program adaptation quickens or slows to match the pace of change in the context, your monitoring must adjust if it's going to continue to provide useful information. And then to consider interrelationships, perspectives, and boundaries. So 3 central systems thinking concepts can guide monitoring and complexity. Your interrelationships, perspective, and boundaries. And taken together, these 3 concepts outline the scope, focus, and intent of the systems field. So let's get a bit more specific. We now know what complexity-aware monitoring is. When do we use these methods? So the next part of this session will focus on matching complexity-aware monitoring approaches to research questions we might want to answer. As I mentioned earlier, when we work in complex scenarios where interventions are complex or the system is complex overall, how do we monitor and evaluate programs? Traditional performance monitoring and evaluation isn't always feasible in these challenging scenarios, and there may still be unanswered questions. CAM approaches can help answer several of the questions that these scenarios raise. And some of these questions are based on concepts and principles I just mentioned or outlined in the slide here. So what outcomes are we missing? What outcomes might yet emerge? How do stakeholders perceive the intervention? And you may have many different sets of stakeholders with different perceptions. What factors contributed to the observed outcomes and what's happening in the wider context? We're going to see what methods could be used and when to answer some of these questions. What are examples of CAM approaches? So given the time constraints today, I'm only going to be able to touch briefly on a few approaches, but there are many, if not hundreds, out there. So this is just a very small window into them. If you'd like more detailed information about each approach, there are 9 approaches, I believe, that are presented in the CAM guide. And we discussed those approaches in even greater detail in that workshop series, which you can access on the Momentum website. And if we've piqued your interest in any of them, you can refer to these slides or to the guide to learn more. And the guide actually links to case studies and reference documents that describe how to implement the approaches in more detail. So here are a few examples of CAM approaches, and you've likely heard of some or many of these. You may even have used these approaches without knowing the name that's used here. Many of these approaches build on or utilize traditional mixed methods approaches that many of us have used, like focus group discussions, but they provide potentially unique ways of framing questions or engaging informants. And that brings me to a very important piece of advice that is to not let names or terms used in these approaches intimidate you. I always recommend when learning about a different approach to try your best to skip over the names and the concept or the new terminology and try to think about how the approach is similar to something you've done in the past. In many cases, they're very similar with just a few added tweaks that add to adaptability or help with documentation or promote triangulation or stakeholder engagement. For example, pause and reflect is one of the most commonly used and straightforward approaches. It requires the user or project to simply pause at some point during or after implementation and reflect on what went well, what challenges were encountered, and then brainstorm ways to overcome persistent challenges. You can Google it and you'll find templates for documentation and unique ways of engaging those who participate. But in the end, it's just an approach that promotes pausing, reflecting, and brainstorming solutions or a path forward in a very intentional way. Social network analysis is another one listed here, and it builds on stakeholder mapping that many of you may be familiar with, but it maps connections across and between stakeholders and explores the connections in greater detail. Ripple effect mapping builds on focus group discussions and is a more visual and engaging way to ask a group of people about the various and cascading effects of an intervention, activity, or event. Some approaches you'll see require more time, more effort, or expertise that we'll get to in just a minute. But the main takeaway here is to learn about these approaches by first identifying how they're similar to what you've done, and then move on to what makes them a bit different. Because for some of these approaches, honestly, people have created an entirely new language and lexicon around them, and I really feel like that can be a barrier to entry at times. So I've listed a number of the approaches here. which includes pause and reflect, outcome harvesting, most significant change, ripple effect mapping, social network analysis, and then contribution analysis. Estelle, if you can click once. Thank you. Important arrow. So this is the approach that Caitlin will describe in more detail in her presentation, but I wanted to just share a quick overview here. So briefly, contribution analysis is really a structured approach to better understand the factors that lead or led to an observed outcome. It includes 6 steps that the user can work through that build from an intervention, activity, or policy's strong causal framework. This approach is particularly useful in contexts where a relationship between the activity and the intended outcome isn't clear. And so with that, I will let Caitlin dig into that a bit more in her session. But for now, let's discuss more about how you would choose between these different approaches. So how do you choose among them? So here you'll see a matrix that is in the CAM guide that can help you select among the various approaches. And over the next couple of slides, we've broken that matrix down a bit. Here in the matrix, we start with 5 missing and difficult questions that I discussed earlier. Those are running down the y-axis, and then across the x-axis at the top are 9 different CAM approaches that are in the guide. And if the approach is particularly well suited, there is a dot. So you can see that some are particularly well placed for exploring what outcomes we may have missed, like pause and reflect, outcome harvesting, most significant change, and ripple effect mapping, while others like causal link monitoring, outcome mapping, and sentinel indicators are better able to answer questions about what might yet still emerge. Some approaches are better suited to explore stakeholder perceptions or to provide information about the wider context. And most in this chart are able to explore what factors may have contributed to outcomes. So when do you need the answers? That's another question to ask yourself. When looking at timing in the project or intervention, some of these approaches are best suited to do early, and some are best suited to do later in project implementation. Though really all of them can be used towards the end of a project life cycle or as part of evaluations or retrospective analyses, as you'll see here. So finally, what resources do we need to implement a specific CAM approach? So I know this slide is super small to read the text, but remember that this matrix and all of this information is in the CAM guide that's on the website. So on this section of the matrix, we show that many of the approaches can either be quantitative or qualitative or both. Then we look at the ease of use in terms of skills and resources and the level of effort that it would require. And finally, the type of engagement means, what is required in terms of engaging your stakeholders. So can you do this entirely remotely from your desk? Or can you do it virtually with virtual stakeholder meetings? Or do you really need to be in person to do the work and the engagement? And just a note, all of these are approximations, and all of these are going to be highly adaptable and context dependent. The ease of use is going to vary by how the project chooses to implement it. So, and also just to keep in mind, while implementing CAM in a highly participatory way may be more challenging and time intensive, so much of the rich value that comes from CAM is going to come from that participation. So it is really important. Next slide. So final slide. How do you choose just one CAM approach? And the answer is you don't have to. I suggest choosing several approaches to use over the course of your projects and to meet your different needs. They fulfill different functions. Sometimes they're overlapping, and at times they're appropriate to use together. Some of the approaches have common aspects or components. And they may even have evolved from or intentionally use components of other CAM approaches. For example, outcome harvesting uses aspects of contribution analysis and outcome mapping. Outcome mapping was developed to complement outcome harvesting. So the matrix can be used to select among approaches and gather ideas of how to use them together. Additional guidance on how specific approaches work well or potentially overlap with each other can be found in the guide. But I also recommend, honestly, to get started, just pairing one or more approaches with your traditional monitoring and evaluation, see how they work, as well as consistently just trying to incorporate findings that emerge from CAM with quantitative and qualitative data to really promote data triangulation. So with that, I think I've spent enough time talking about CAM generally. Let's get into some more specifics. So to do that, I'd like to hand things over to my colleague, Caitlin Matavu-Matson. She is the MEL lead for USAID CHISU project and is going to discuss how they're using CAM approaches in their highly complex work. Caitlin?
Thank you so much, Emily. Good evening, good afternoon, good morning, everyone. We're very excited to join the Momentum Knowledge Accelerator today and share with you how we have been applying one of the complexity-aware monitoring approaches on the CHISU program. Next slide, please. So I will get into more of the details in just a bit, but I just wanted to start out, as Emily mentioned, we have selected and are using contribution analysis. But let's start out with a quick overview of why. Next slide. So as you heard very briefly at the beginning of the webinar, CHISU is the Country Health Information Systems and Data Use Program. Our work is really focused on strengthening health information systems and how people use data. And this is really inherently complex. Our overall program theory of change is here on the screen in front of you. It shows our 4 strategic objectives. And to reach our vision, which is in the middle of the slide, we are working through supporting very important governance and leadership on the top left. We are working through optimizing demand and use of high quality data on the bottom right. We're working through direct working with the specific digital systems and software on the top right. And on the bottom left, we're working through the reinforcement of local organizations who can continue to support work with their governments in future years. But, you know, as I'm not going to go into too many details on the theory of change, but how do we really measure all of the different components that are working together and how they interrelate? This was one of our big problems. Next slide. So our underlying framework for the CHISU program is called the Health Information Systems Stages of Continuous Improvement Framework, or Toolkit. I also will not go into too many details about this. We have many other webinars that will tell you a lot more about it. But it is, at its base, a maturity model. It outlines how 5 different domains of health information systems, these are the arrows in the middle of the screen, and it shows us how those different domains of a health information system can progress through different stages of maturity. These are the different steps that are listed on the top of the screen. And so as a program, CHISU uses this framework to essentially evaluate our success in each country. How well are we supporting them to advance the maturity of different domains? Next slide. So our MEL team works with each country to develop a causal framework. A very rough template is on the screen. This framework describes the connections between our work in that specific country, the key interventions, which are there on the left-hand side of the middle part of the screen. And what are the connections between those interventions with the improvements in the different parts of the health information system across our different strategic objectives, the different colored boxes on the right-hand side in the middle. This is all within the context of that SOCI, the stages of continuous improvement, within that framework. And so we really are hoping in our countries to have a baseline at the beginning on the far left and a follow-up assessment to show progression. We are not always able to do this assessment formally. However, we are able to do at least an informal assessment, and we're able to use to show this progression. So our primary technical indicators for our project are focusing on the different boxes that are in this diagram. We look at the country level HIS progression from the SOCI assessment. We also count the number of interventions and the improvements that they lead to. And these numbers that we track are not small. We've implemented in 38 countries cumulatively, and we have reported on over 450 interventions and over 100 improvements so far. And so we are exploring the patterns and connections across different countries, across different strategic objective areas, and across different health areas, different funding streams that we have. So you can see we already have a rich amount of data that we are exploring. However, this diagram drastically simplifies the true links between the various interventions that we implement, the improvements we realize, and any of the health information system progression in maturity. Reality, as Emily mentioned, is always much more complex than this linear diagram. So the numbers we are reporting on and we're doing interesting analysis with, they do not capture the rich qualitative information about the linkages. They do not capture the complex environment of multiple partners and other work that's happening in the countries to support the same health information systems that we are working on and the broader health system in that country. Next slide. So this led us to the method of contribution analysis. Our overall approach of CHISU had so many unknowns. We do not know the mechanisms of successful health information system strengthening. We also do not know how well our maturity model, the HIS SOCI toolkit, we don't know how well it serves us to really carry out this work and demonstrate that progress in our countries. And we do not know the mechanisms of how HIS strengthening, a pillar of the wider health system, actually supports the broader health system's strengthening. So contribution analysis is helping us to better understand the factors that led to our observed outcomes so far. We wanted to look at outcomes in the health information system itself from our SOCI framework, but we also wanted to look at the broader health systems outcomes in some of our countries where we've done significant work in a specific health area like malaria or maternal child health. It really helps us to account for all the complexity, and honestly, the contribution analysis is also helping us to combine and use other CAM methods because it is so flexible. So next slide. So just as a reminder, this is a repeat of one of Emily's slides. As she introduced the contribution analysis, going back to the basics, it is a method that helps us answer some of these really big evaluative questions. And it helps us look at how our work has contributed to the outcomes that we are seeing now. It's usually carried out closer to the middle or the end of the program. It relies very heavily on having a strong causal framework, which you have seen we have at hand. And it uses qualitative and quantitative methods. And all of these components of contribution analysis aligned well with our needs. Next slide. So, how did we really plan to use the contribution analysis methods in our countries? Next slide. So at the moment, we are starting small. We are working in just 2 countries where we've been implementing the longest as the CHISU program. We started work in Burkina Faso in 2020 and in Serbia in 2021. Another important selection criteria for us was that both of these countries conducted a formal baseline Sochi assessment in 2021, and they both recently completed a repeat assessment in 2024. So this gave us a reasonable amount of 2 very diverse country contexts where we could try out this method. We are not starting out very small, though, with our guiding questions. We are looking at health information system outcomes from the Sochi assessments. And we're also looking at health system outcomes like equity, quality, and resource allocation in specific health areas in the countries wherever it is relevant. So our first step, once we've selected our countries and we decided on these very big questions, we needed to figure out what outcomes we would focus on. And that required us to go back to our causal frameworks and develop a more detailed theory of change for that country. Next slide. So here's the causal framework that we saw earlier, but now it has broader health system outcomes on the far right. And so to get a more detailed theory of change for each country, we went through a process building on this causal framework. If you could click once, Estelle. Awesome, thanks. So first, we confirmed with our country team all of the details of what we really did. Not just some of the details about the key interventions, but all of them. Where were we targeting our work within the framework of the Sochi? How long did we actually do that work? And at what level of engagement? How deeply were we involved? Were we very hands-on? Or were we doing relatively high-level technical assistance? You can click once more, please. We also were confirming with our teams what improvements really happened as a result of our work, and what was all of the information we could gather about those improvements. Next click. So that is when we next got to a place with our teams to look at our health information system outcomes. Now that we have a repeat assessment, we can explore what's changed. Are we seeing changes in places that we expected? Are we seeing changes in places that we did not expect? We also are working with our teams to draw more nuanced linkages between all 3 of these levels, between our interventions, the improvements that we've seen, and the outcomes in the health information system maturity that we're able to see. Next click. Another level that we're doing with our teams right now is once we have all of those first 3 levels finalized, we're also discussing with our teams, did we do a lot of work in any one health area where we can see that there are outcomes available and metrics for those outcomes that have shown change? Just like the HIS Sochi is showing us our health information system outcomes having changed, are there the health outcomes, for instance, the quality of care being provided for malaria cases, diagnostics and following cases through to completion. Is that showing improvement in the country? We need to find where we have data to support that the situation in the country has really changed. Next click. Then once we have identified those outcomes that have changed, both from the health system and from the health information system, we work our way backward through that detailed theory of change overall to develop outcome-specific theories of change that demonstrate where Chisu really contributed to those observed outcomes at both of the levels. All right, next slide, please. So to do all of that work that I just walked you through, you can appreciate it requires a lot of input. We are doing very extensive desk review, reviewing all of the internal reports that we receive from our teams throughout the entire period of implementation in the country. We're obviously using the reports of the HIS Sochi assessments from both the baseline in 2021 and our repeat assessments in 2024. We're also looking at national documents. In both countries where we're working, they came up with an action plan after the Sochi assessment, and they've conducted monitoring of those action plans. And so we will be reviewing those reports to see, well, what happened in the whole country, those things that were supported by Chisu, but other items that have happened as well, to demonstrate a little bit about what that situation has been throughout the period and how those things may help support the Chisu's contribution and also describe how others have contributed to the outcomes that we see. We also carry out routine pause and reflect sessions with our teams. And from those, we're getting a lot of information, not only on the progress of our own activities and what we are observing, but also some of the specific challenges, assumptions that we're realizing may not be following through and all of that. And that also helps to support that contribution story that we are developing. Other than the desk review of what's already available, we are doing some original data collection. That process I just walked you through is being done through theory of change workshops with our teams internally, and then we are also going to be reviewing some of those results with external stakeholders. And we're following up with key informant interviews, and in a few places we may also do some focus group discussions to really dig into any areas that still feel unclear in our contribution stories once we are pulling it all together. Next slide. Just a quick picture for those of you who are interested in how long does this all take? I admit I didn't write on this screen. I think we were collaborating with USAID on a concept note. I believe it was in kind of January, February. We did write up a formal research protocol for this work since we're doing original data collection in particular, and we got approval in May on that protocol. We are continuously working through all of those materials on the desk review, and we've initiated our data collection in all of the countries. Oh, sorry, Indonesia's here from a related study, but we have started in May in Serbia and in July in Burkina Faso, and we're still working through all of that original data collection to date now. In July, and as you write an end date on things, they will probably spill into August, but we're getting there. Next slide. So I thought it might be helpful to share with you some of our initial results. Next slide. So this is the graph of the HIS Sochi assessment results. These are draft results from Serbia, and it shows us the 2021 scores, what they considered their current status in 2021 in blue. And in green are the current scores for 2024 in green there. And you can see across all of the different domains are the 5 domains of Sochi are across the bottom of the screen. And we've actually shown this graph with the different components that come underneath each domain. You can see across all of the different components, the country has shown some change, and all of the change has been in the positive direction, right? They're all going up on a scale of 0 to 5. Across all of the components, every single one has gone up at least a little bit, except one. The one area that has not really shown change in Serbia over this time period is interoperability. That is something they are really working on, but it was not their biggest focus from the beginning. And so we can see here, so far, they do not see those changes yet. All of the other areas have changed a little bit, but we can see the largest improvements, at least one full step in the maturity stages in health information systems strategy. That is on the far left. We also see at least one full stage improvement under ICT infrastructure in a few places, actually, I think in all 3 of the components, operations and maintenance, their communication networks, and their business continuity. And then on the far right in their data quality assurance as well. And all right, next slide. So I know this shot is very zoomed out and you will not be able to read the exact details, but this is a version of our theory of change that we worked on with our team in Serbia. And I wanted to share it with you to show you how the linkages are really coming through when we hold our theory of change workshop. So on this screen, again, I know you cannot read the details, but on the left-hand side of the diagram are the interventions that we saw on our earlier diagrams. We can see it is not linear how those different interventions are linked to the improvements. Those are in the middle of the screen. It is not at all linear. We see the arrows going all over the place. Strategic Objective 1 in brown is on the top. The Strategic Objective 2, which is focused on the systems and software, is in the middle, and our work on data quality and use is on the bottom. Our previous diagrams showed very linear connections between interventions, improvements, and Sochi. This shows us that linear relationship is not reality, right? So we were able to see a wide variety of connections between the different strategic objective areas and between the improvements and the various parts of the Sochi assessment that we're able to see how things have improved. So we're able to see how the work in governance is contributing to improving the systems and data exchange. And similarly, we're seeing that our work in standardizing and improving the connections between systems through interoperability and standards is contributing to improved use of data, which is on the bottom of the screen. So I will not go into the excruciating details of this diagram, but I just thought it would give you a flavor of what this method has been able to help us realize. And so I am finished with my presentation now. I am really excited to be able to answer your questions, though. Thank you.
Thank you, Caitlin, for your wonderful presentation. I know I learned a lot myself from hearing about Chisu's experience with CAM and the contribution analysis, and I already see that some questions are coming through from others who are looking to learn more too. So before we launch into our Q&A session, we are going to do a quick, what we call a waterfall question. So now that you've listened to Emily's overview of CAM and the approaches and heard more from Caitlin about Chisu's experience with CAM, our question today is, can you think of ways that you can apply complexity-aware monitoring in your own work? So if you can think of any ways, even if you've identified some approaches that you want to try, please put a 1 in the chat. See some ones coming in. A lot of them already, which is great to see. So if you put a 1 in the chat, we would love to hear your ideas about how you plan to use CAM in your own work. So we won't, for the purpose of time, we won't read out these ideas, but even if you think I could use pause and reflect, I could use contribution analysis, please feel free to write those in the chat and we'll look forward to following up with you to see how you've used CAM in the future. So we are now going to move into our Q&A session. So thank you to those who have already put your questions either in the chat or the Q&A. If anything has come up now that you want to know, please feel free to put your questions in the Q&A. So we are going to start with a question from the chat first from Ramsey. So our question is, when using pause and reflect as a CAM approach, we might already plan routine pause and reflect and have it as an existing practice with a set of expectations. When talking about using pause and reflect as a CAM approach, would it require a more specific agenda? Would you recommend a purposely designed pause and reflect for fulfilling a CAM purpose? Or is having a routine pause and reflect, like is recommended by USAID in the CLA framework, in and of itself enough to cover this purpose? So Emily, do you want to answer that one?
Sure. Thank you, Devin. And that's just to say that's a great question. And first off, I just want to say kudos, Ramsey, to you and your team for already having routine pause and reflect sessions planned. I think that's great. It's a great start. In terms of implementation, one thing that I really like about these CAM approaches is around the intentionality of activities that may have been a bit more informal previously. But they're also flexible. So if you want to take your pause and reflect activity and make it more formal, you can, use different templates or whatever to document the questions and the responses and actions that you plan to take moving forward that result from the activity. I think that's great. And I think that will likely help you moving forward. A record of discussions and decisions is always nice to have, but whether or not that makes it CAM, or it's CAM, whether you do that or not, it's still a complexity-aware approach. You can choose how formal or informal you want to be with it. But again, I like how these a lot of the literature and the resources around these approaches sort of includes more documentation, templates and opportunities, and helps make them a bit more intentional. I hope that answered your question.
Thank you, Emily. So we have a question now from Amanda for Caitlin. So how did Chisu determine the appropriate amount of time between the steps, especially in complex settings? We know impact can take time to see.
It really can, yes. I would have to say we took advantage for this contribution analysis of both countries, Burkina Faso and Serbia, deciding themselves that they wanted to do a repeat assessment. It was not generated from Chisu directly that we said they needed to do it. It was actually both countries are reaching close to the end of a strategic plan or the action plan that they had set out after the first assessment. And so they're using this as their own monitoring mechanism. And so we decided to take advantage of that and jump in. So for us, that was probably one of the biggest time drivers. We really were taking advantage of that. The other time factors that I think are also possibly related to your question is perhaps the time between our interventions and the improvements that we are documenting. And there, we totally agree with you. Improvement takes time, especially in these complex environments. And the kinds of improvements that we are looking for are not quick. And so honestly, through our analysis of all of our intervention and improvement data that I mentioned, we're noticing, we haven't done the final analysis, but we're noticing at least a year delay between when we kind of are beginning to work in a certain area and when we're starting to see the decent kind of fully documented improvements that demonstrate the success of those interventions. And that's just one of those single pathways in that larger diagram. We're seeing really at least about a year, but it is something that we're doing more analysis and wanting to explore more. Thanks.
Thank you, Caitlin. So I'm going to skip down to Bruno for our next question. So what is your experience regarding how receptive the local stakeholders, such as Ministry of Health, are to use CAM in their day-to-day work? And how are you building their capacity for sustainability?
That's great. You want to take that one, Caitlin?
I can start off. I can say right now, we are, as I mentioned, we're doing our data collection right now, and we're engaging with them on the Sochi results and this kind of bigger theory of change, and kind of talking to them about how all of these different connections are coming together. We are not at the moment bringing them in terms of the research team for this particular round. This is our first time trying it out in this formal way. However, this is just the beginning. We are working, we have worked overall cumulatively in 38 countries, right? We're hoping to do this in more countries once we kind of iron out the kinks and figure out how this works well for us in these two country contexts. And it is something we're hoping to involve more going forward. So thank you.
To add on to that too, I'm preparing to head to Indonesia to do a ripple effect mapping workshop with some of the folks that are actually on the call today. And I think that's one of the nice things about some of these approaches is just how they do prioritize engagement. Ripple effect mapping in particular is very visual, allows people to see what you're doing and what, how the analysis is happening as they're sitting there and watching it. And I think that helps folks feel more engaged in the process and also gives them an opportunity to validate, what you're pulling out of it. So I look forward to seeing how that will work with some of the local stakeholders, but I have really high hopes for it.
Thank you both. We are unfortunately out of time for our Q&A session, so apologies to those questions that we're not able to get to, but we can discuss as a group to see if we can follow up with some answers to those. So I am going to turn it over to Emily to go over some key takeaways from today's event.
Great. Thanks, Deb. So I think with that, we will wrap up for the day. I wanted to present a few main takeaways from this session. First off, if you're working in public health, you're likely working in a complex environment, and these approaches may help answer some of the questions that aren't easily addressed by your traditional MEL approaches. These approaches are flexible and adaptable, and they can be incorporated in and used in tandem with traditional approaches, mixed and matched together. Contribution analysis, as used in the context of CHISU, is one approach that can really help you better understand contributions, outcomes, and the overall impact of a project or an activity. And finally, these approaches formalize and build on things you're likely already doing. So don't be intimidated by the language. And I really encourage you to just dive in and see how these approaches just might help tell your project's story. Deb, do you want to close things out?
Sure. Thank you, Emily. So thank you all for attending today's event, and a big thank you to Emily and Caitlin for your wonderful presentations. I know that they were very well received by everyone, given all of the great questions that we got. So I'm really looking forward to continued conversations on complexity-aware monitoring. We will be following up with you all by email to share the presentation from today's event, and we'll also be sharing the recording. So as you see on the screen now, we have a QR code that links directly to the CAM resources that are available on the Momentum website. So we definitely encourage you to check that out, and we'll be following up with these links to the resources as well. So as I mentioned before, if you do have ways that you think you could use CAM or that you're already using CAM and you want to put those in the chat so that we can follow up with you after, we'll leave the Zoom room on for a few more minutes. So thank you all, and I hope you have a great day.